Hey everyone, today we're diving into a topic that might seem a little unusual but is incredibly important for your health. We're talking about strange smells and how they could be potential warning signs of cancer. Now I know what you're thinking. Cancer from a smell? It sounds odd, but trust me, our bodies are constantly communicating with us, and sometimes those messages come in the form of unusual scents. While not every odd smell means you have cancer, certain odors, especially if persistent, can be red flags that warrant a conversation with your doctor. In this video, we'll explore 8 different types of cancer and the specific smells associated with them. Remember, early detection is key when it comes to cancer treatment, so understanding these potential warning signs could literally save your life. So, let's get informed and stay healthy together. Let's start with mouth and throat cancer. One of the most alarming signs is a persistent bad breath that smells like moldy or rotting wood. This unpleasant odor can be caused by a few factors related to the cancer itself. First, as the tumor grows, it can damage and kill healthy tissue in your mouth and throat. This process, known as tissue necrosis, releases foul-smelling compounds. Second, these areas of dead tissue can easily become infected, leading to further odor. Finally, cancer cells themselves release volatile organic compounds, or VOCs, which can contribute to the distinctive smell. Now, bad breath is incredibly common and usually due to something as simple as needing to brush your teeth better. But when it's persistent and accompanied by other symptoms, it's time to see your doctor. These symptoms include a sore throat that doesn't go away, difficulty swallowing, hoarseness that lasts for more than 2 weeks, unexplained ear pain, white or red patches in your mouth, or any lumps or swelling in your neck. Remember, early detection is crucial for successful treatment of mouth and throat cancer. So, if you're experiencing any of these symptoms, especially the persistent smell of decay, don't hesitate to schedule an appointment with your doctor or dentist. Moving on to colorectal cancer, which affects the colon and rectum. One of the potential warning signs is a strong, persistent smell of decomposition in your feces. This foul odor is often described as being much worse than a typical bowel movement. The reason behind this unpleasant smell lies in the way colorectal cancer disrupts your digestive system. As the tumor grows, it can obstruct the bowels, leading to a buildup of feces and gas. This disruption can also alter the balance of bacteria in your gut, further contributing to the production of foul-smelling compounds. Now, it's important to remember that occasional changes in bowel movements and their smell are normal. However, if you notice a persistent and significantly foul odor, especially if accompanied by other symptoms, it's crucial to consult your doctor. These symptoms include blood in your stool, a change in bowel habits like diarrhea or constipation, abdominal pain or cramping, unexplained weight loss, and feeling constantly bloated or full. Early detection is key when it comes to colorectal cancer, so if you're experiencing any of these warning signs, don't hesitate to talk to your doctor. Now let's talk about breast cancer. While less common than other cancers on this list, breast cancer can, in advanced stages, present with a sweet, somewhat unpleasant odor emanating from the affected breast. This unusual smell is often associated with infected or necrotic tissue. As the tumor grows, it can damage surrounding tissue and blood vessels, compromising the body's natural defenses. This creates an environment where bacteria can thrive, leading to infection and the release of foul-smelling compounds. Additionally, as cancer cells die, they release substances that can contribute to the odor. It's important to note that this particular symptom is usually present in later stages of breast cancer, often when the tumor has grown significantly or ulcerated through the skin. However, being aware of this potential sign, along with other more common symptoms, is crucial for early detection. Be on the lookout for any changes in your breasts, such as lumps or thickening, skin dimpling or puckering, nipple discharge or inversion, redness or scaling of the nipple or breast skin, or persistent pain in the breast or armpit. If you notice any of these symptoms, don't hesitate to schedule an appointment with your doctor. Moving on to stomach cancer, a type of cancer that affects the lining of the stomach. One of the potential warning signs is a persistent sulfur-like odor in your breath, often described as smelling like rotten eggs. This unpleasant smell is linked to the way stomach cancer disrupts your digestive process. Normally, your stomach produces hydrochloric acid to break down food. However, in stomach cancer, this process can be disrupted, leading to the production of hydrogen sulfide gas, which has that characteristic rotten egg smell. This gas can be released through your breath, causing the noticeable odor. While occasional bad breath is normal, a persistent rotten egg smell, especially if accompanied by other symptoms, should never be ignored. These symptoms include persistent indigestion, nausea, vomiting, feeling full quickly after eating, unexplained weight loss, abdominal pain or discomfort, and blood in your vomit or stool. If you're experiencing any of these symptoms, don't hesitate to consult your doctor. Early detection is crucial for successful treatment of stomach cancer. Now let's talk about skin cancer, a type of cancer that affects the skin cells. While skin cancer often presents with visible changes in advanced stages, it can also emit a disturbing odor, often described as smelling like rotting meat or decaying flesh. This gruesome smell is a result of tissue necrosis, where cancer cells outgrow their blood supply and begin to die. As these cells break down, they release foul-smelling compounds, leading to the characteristic odor. This symptom is more common in advanced cases of skin cancer, particularly in larger tumors or those that have ulcerated through the skin. Remember, early detection is key when it comes to skin cancer. Regularly examine your skin for any new or changing moles or lesions. Look for the ABCDEs of melanoma: asymmetry, border irregularity, color changes, diameter greater than 6 millimeters, and evolving size, shape, or color. If you notice any suspicious spots on your skin, or if you detect a persistent foul odor emanating from a skin lesion, don't hesitate to consult your dermatologist. Early diagnosis and treatment significantly improve the chances of successful outcomes for skin cancer. Moving on to kidney cancer, a type of cancer that affects the kidneys. One potential warning sign is a strong ammonia-like smell in your urine. This pungent odor is a result of the kidney's inability to properly filter waste products from the blood. Normally, your kidneys filter out waste products like urea from your blood and excrete them in urine. However, in kidney cancer, this filtration process can be disrupted, leading to a buildup of urea in the bloodstream and subsequently in the urine. Urea, when concentrated, has a distinct ammonia-like smell. While occasional changes in urine odor can be normal, a persistent and strong ammonia smell, especially if accompanied by other symptoms, should never be ignored. These symptoms include blood in the urine, pain in the back or side below the ribs, a lump or mass in the abdomen, unexplained weight loss, fatigue, loss of appetite, and persistent fever. If you're experiencing any of these symptoms, don't hesitate to consult your doctor. Early detection is crucial for successful treatment of kidney cancer. Now let's discuss blood cancers, such as leukemia and lymphoma, which affect the blood cells and lymphatic system. One potential warning sign is a metallic smell in your breath or sweat, often described as resembling rusty iron or old coins. This unusual odor is linked to the changes in blood chemistry that occur in blood cancers. As cancerous blood cells proliferate, they can release substances that alter the composition of your blood and bodily fluids. These changes can result in the production of volatile compounds that contribute to the metallic smell. While a metallic smell alone is not a definitive diagnosis of blood cancer, it's essential to be aware of this potential sign, especially if it's persistent or accompanied by other symptoms. These symptoms include fatigue, weakness, shortness of breath, pale skin, easy bruising or bleeding, frequent infections, swollen lymph nodes, bone pain, and unexplained weight loss. If you're experiencing any of these symptoms, don't hesitate to consult your doctor. Early detection and treatment are crucial for managing blood cancers effectively. Finally, let's talk about lung cancer, a type of cancer that affects the lungs. One potential warning sign is a sweet, fruity odor in your breath. This unusual smell is linked to the way lung cancer cells alter your body's metabolism. As lung cancer cells grow and divide, they release volatile organic compounds, or VOCs, into your bloodstream. These VOCs can travel to your lungs and be exhaled in your breath, giving it a sweet, fruity odor. It's important to note that this symptom is more common in advanced stages of lung cancer. While a sweet smell on your breath doesn't automatically mean you have lung cancer, it's crucial to be aware of this potential sign, especially if you're at risk or experiencing other symptoms. These symptoms include a persistent cough that worsens over time, coughing up blood or rust-colored phlegm, chest pain that worsens with deep breathing, laughing, or coughing, hoarseness, shortness of breath, wheezing, repeated respiratory infections, unexplained weight loss, and fatigue. If you're experiencing any of these symptoms, don't hesitate to consult your doctor. Early detection is crucial for successful treatment of lung cancer. So, there you have it. 8 unusual smells that could potentially signal cancer. Remember, these smells alone don't necessarily mean you have cancer, but they should never be ignored, especially if they're persistent or accompanied by other symptoms. Your body has a remarkable way of communicating with you. Paying attention to these subtle signs and seeking medical advice when needed can make all the difference in early detection and treatment. If you're concerned about any of the smells or symptoms discussed in this video, please don't hesitate to schedule an appointment with your doctor. Remember, knowledge is power, and taking charge of your health is the best way to stay ahead of any potential problems.